Hi, Keith is with Balance Body Mind. Today I want to talk about spinal dysfunction and often seen clinical considerations for the back. Often get a lot of people who have been diagnosed maybe from having an MRI of having a certain spinal condition. They often seem worried because it sounds like quite a complex thing that they're experiencing. But if I talk about three particular spinal conditions, usually the outcome is the same thing. First one I talk about is a disc herniation. Within a disc herniation, here we have each vertebra of the body, and you have a piece of tissue between each vertebra, which is the disc. If I use the analogy of a donut and the jam being squirted out of the donut, this is what happens, and basically we have the disc pushing out, usually back onto one of the exiting spinal nerves. It can be central, it can be bilateral, it can be also just one-sided as well. So sometimes when we get some pressure on the nerves or there's some inflammation created, this can cause problems, pain and subsequent changes to the way people move. The disc herniation can usually be rectified with a number of things: the right type of exercise, breathing correctly, the right type of therapy. As is the same with any spinal condition, you should really look to treat it conservatively before you think about any surgical procedures. Another one of the common things that we tend to see, not as much as maybe as the disc herniation, is a spondylolisthesis. The spondylolisthesis is usually where we have a break in the vertebra between the vertebral body and this part of the spine, where the spinous process and the facet joints are attached to, and we see a breakage of this body. And what tends to happen is the vertebral body tends to rotate and slip forwards, and that can cause undue pressure on the disc, creating pain, and also maybe changes and compromise movement dysfunction as well. One of the other things we tend to see is a stenosis, and a stenosis usually occurs around the intervertebral foramen, which is this hole that exits the spine. Now, what can tend to happen is usually when there can be dysfunction, we may have undue tension and stress on one side, and we can see this foramen, the hole where the spinal nerve exits, can often close down, compromising what kind of signal comes out of the spinal nerve. One of the things that we can do is look to increase the stability and mobility of the spine and try and get that opened up a bit. Sadly, what tends to happen sometimes, we get some osteophytes, which is some bony growth that can grow around this area and inhibit it further. But with any client that comes in when they have a spinal condition that needs addressing, really what they want to think about is understanding what got them there in the first place. 9 times out of 10 we can actually kind of look at the type of exercise, the breathing pattern, their dominant positions such as their work posture, maybe seated at a desk, and look at these things and bring around some change to each functioning unit of the spine. Assessing what's actually going on, finding out which muscles are working too much, which ones aren't working enough, looking at the way that someone breathes, and then trying to break that cycle is probably often the easiest way to go. Short surgery could be considered if it's the very, very last throw of the dice. But in most cases, I've seen many people with spinal conditions resolve favourably with the right type of therapy or the right type of exercise. So before you start worrying about the name that you've been diagnosed with, go and see someone who understands movement, therapy, and ultimately exercise to get you aligned as much as you can, but also breathing, moving and functioning at your best, and you'll often find that many of your spinal conditions will get much better.